PhysZOU is a pro bono clinic that's part of the PT curriculum, and it serves the community members at large, folks that don't have insurance, or maybe they have insurance but it doesn't cover physical therapy services. And so PhysZOU provides those physical therapy services to those community members, but it also gives our students the opportunity to interact with community members, giving them those hands-on experiences that they oftentimes don't get until they go out on their clinical experiences. So really it's an opportunity for our students to learn, but it's also an opportunity to serve the community.
My exact favorite experience was when I was actually in a neuro rotation. So out of the three, again, we have neuro, ortho, and peds. I was in the neuro rotation, this lady, she came in and she just had a bunch of back pain, and the back pain has been there for a really long time. And she was put through she went to see a whole bunch of doctors, got a whole bunch of x-rays and MRIs, and just nothing. They came back negative. So I took it upon myself to apply what I learned in our orthopedics class, and I did some manual therapy. So I did some manual therapy on her back, some manipulations, some glides and things of that nature. And she got up off the table and she said, "My back pain is gone." I would say that's my biggest sort of accomplishment so far in my career that hasn't started yet.
Our students have the opportunity to practice the skills. They have the opportunity to get creative in terms of how to do treatment plans. All this is great preparation for when they go out on full-time clinical experiences. It gives them a great opportunity to practice communication, to work on their confidence, so it's excellent for our students. However, the patients also have this incredible opportunity to get services to help them reach goals that maybe they thought were unattainable, to help them gain the strength to be able to do things that they didn't think they could do before. So it's a win-win in my mind. There's a benefit for everybody.
So even coming down today, working with the patient, she has some vestibular issues, which affects her balance, especially while she's doing activities. And we were starting to learn about that in some of our classes and some of the different tests to check for those symptoms. So it is really cool getting to see the actual application.
My name's Brenda Brockmeyer, and I started in the spring. This was kind of just a drastic thing that happened to me. I was in the hospital in February, and my daughter told me about the program because when I left the hospital, I was in a wheelchair. We're working on my balance because I had the fear of falling. So they're just giving me the confidence and giving me the tools to work, to do it with. I've come a long way because of the therapy.
Embrace the challenges, embrace the opportunity. This is an opportunity for growth, opportunity to learn. PhysZOU would not be possible without the patients that we serve, so thank you to our patients. We're very grateful for them.